I'm Diane Powell with the Allied Health Career Training. This is Home Health Aid. The state of Kansas is set up where you need to have your CNA, nurse aid. Your certified nurse aid certificate must be cleared and active before you can take your home health aid. So if you have not taken your CNA yet, this course is not for you. You need to have your CNA first, then the HHA is open for you, okay? Want to make sure you understand that. All right, this is a 20-hour course, meaning that most people will finish this in about 20 hours. That means you need to make sure you set enough time aside in your busy schedule to ensure that you can get this done. This is a fast class, fairly easy, there's no clinicals, so I think we can move right ahead. And let's just do that then. Okay, home health. When we talk about home health, we're talking about an umbrella term. There's a lot of different categories that fall under this umbrella of home health. You can have Medicare home health agencies, hospice, that falls under home health, insurance, private insurance. Then there's some state waivers that usually are Medicaid, at least in Kansas, most of them are. And these are like your frail elderly or your physically disabled waivers that usually come through Medicaid. And we're going to talk more about that here in just a second. And then, of course, you have private pay. All of these are under the banner of home health. So when we have home health, what we're really talking about is getting health care in our homes. Right? Everybody wants to be home. Nobody wants to go into a nursing home. There have been studies done about that. And a lot of people will say, I want to stay home. And home health is a way to help people do that for as long as possible. So let's talk about this. Let's tear some of this into some of this and look at the differences. First, let's talk about companion care versus home health care. Companion services are people who are not necessarily HHAs. They may not even be CNAs. They are companions. They may come in and clean the house, do some dishes, maybe cook some meals, sit and visit with the person, that kind of thing, but they cannot do any vital signs. There's a gray area on things like helping them get up and out of bed and dressed. That's kind of gray. And then the real hands-on, like giving them showers and personal care. Then again, some companies I know do it with folks that aren't actually even CNAs, but and in Kansas there's kind of a loose area in there. But companion care basically is just what it says, a companion, someone to run errands, take them places perhaps, do some cleaning, laundry, that type of thing. Where home health, you're going to be doing vitals, you might be reminding them of their meds, you're going to be observing things, tracking things, talking to your nurse about situations, and giving them personal care. Okay, another thing let's talk about, there's so many different terms. There's patient, there's resident, client, participant. Home health, generally you'll hear them called clients. All of these are the folks that we help, that we take care of. Okay, it's just different names that we will refer to them as. Home health, now in a nursing home you might call them a resident, in a hospital you may call them a patient. Client is generally what they're called in home health. Okay, so in home care we take care of folks who are cannot care for themselves. They have either acute or chronic health issues. that keep them from giving themselves the care they need. Now, acute it has an onset. If I get sick with the flu, that's acute. Okay, that happens. It's got a specific onset. It happened, and I may get over that and go on. That's acute. Chronic is a long-term problem that you have to manage. Chronic might be something like diabetes, CHF, COPD. These are things that aren't going to go away. They're chronic, and you have to manage them. Okay, so acute versus chronic. Now let's talk about Medicare versus Medicaid. These are really confusing for some folks. Medicare is when you turn 65, right? 65 years old, at least right now in the US, when you turn 65, you are eligible for Medicare. You pay into this all your working days, and the hope is that when you turn 65, the funds will still be there, and Medicare will pick up certain things. Now, they won't just pay carte blanche, open, just pay for home health. It is very strict, and it's very limited on the amount of time that Medicare will pay for home health. When it is Medicare home health, you must be an HHA. You must be a certified nurse aide, and you must have your HHA certification in order to pick up Medicare home health. Medicare home health comes with lots of rules and regulations. It's the most restrictive. It also pays better. Hospice is actually under Medicare. Yeah, for the elderly. Now, you can have hospice and not be 65 yet and not have Medicare. But if you are 65, hospice is one of those benefits that you get. Okay? And that is not so much limited by time as regular Medicare home health. Now, let me give you an example of when you might see a Medicare payer source for home health. This might be if, say, Joe has a stroke. He was living on his own at home. He has a stroke. He goes into the hospital, and then he goes to a rehab place for maybe a couple weeks. Then he's not quite ready to go home alone, but he doesn't want to go to a nursing home, and he's not quite that bad. They may pick up home health for a few weeks. Usually it comes with therapies like physical therapy, occupational therapy, speech therapy, and it's for a very short amount of time, and there's lots of documentation and stuff that goes with it. Okay? After so long, no longer will Medicare pay for that home health. He's not eligible. He doesn't qualify after a while. Now, that's Medicare. Medicaid is when you have exhausted all your resources. And folks, in today's world, it does not take long to go through all your money. When you stop working and you go on Social Security, that's not a lot of money. And you know how prices have raised. And things are expensive. Do you have any idea how much nursing homes cost? It's not covered by Medicare. If it is, it's for a very short amount of time. Nursing homes can cost between $6,000 and $12,000 a month. A month. So a lot of people don't have the funds for that. And when you burn through all of your money and there's nothing left, then you can go on Medicaid. Okay? So Medicaid is for when we don't have anything left. And if you have a house, if you're living at home, you can stay in your home, but when you pass on and your spouse is gone, then that house has to be auctioned off to help pay for the money the state paid to have care for you. Okay? So this is Medicare. It's very strict, very short. Medicaid lots of times happens when someone has a chronic disease. Maybe, here's an example. I knew a gentleman who had a diving accident in his 30s, and he had been on Medicaid for 30 years, 40, 50 years, because when he broke his neck, he became a quadriplegic, 1, 2, 3, 4. So he was paralyzed from here down. He could not care for himself. He had to have people come in and do that. Obviously, at the age of 30, he wouldn't have had money to do that for that many decades. So he went on Medicaid. Okay, and so Medicaid can go on for indefinite amount of time to care for someone like that. Okay, so that's Medicare and that's Medicaid. And then again, you have hospice. Hospice is for folks that if the disease trajectory goes as it normally does, they have 6 months or so to live. Now, let's say they live 9 months. Oh, well, you're not going to pull them off hospice because they beat the odds a little bit. So it's just if the disease goes by the average normal trajectory. So this is for folks that are terminal, that are in the last stages of life, okay? And that comes under its own headings and programs and rules and regulations. Private insurance, same thing. It all depends. There's 100 different policies out there and they all have their rules and regs. And then private pay. Lots of places out there are private pay because the insurance is terribly expensive and a lot of people just need help at home. And families will go in together and hire folks to come in and take care of mom. Okay? All right, so those are the different payer sources that are out there. The way most home health companies are set up, agencies are set up, you have an owner or a board of directors, then you have your CEO or administrator, and then under that you have your different allied health, the things that support that. You'll have therapies, and this again is your physical therapy, your occupational therapy, your speech pathology, all of these therapies. You have your director of nursing or chief nursing officer, and then you have your social services, which is your chaplain and your social worker that will be there. And then you have volunteers that assist the whole program, especially in hospice. And then you have your RNs and LPNs and your home health aides. You will report to your nurse. That is who you are responsible to report to. Okay? So that is kind of just a quick overview of home health and the various sources of home health care.